Entering a procedure competency. When a student is ready to perform a competency for you, he will pull that individual skill up on his tablet or the department computer while he is logged in. This is the easiest process for the therapist. Prior to observing the student perform the skill, the therapist should look over the competency steps. You can find those competencies here. Simply go to the navigation page and under competencies, you can just use this drop-down box that says Quick Add Competency, and that will give you a list of any competency that DataArc has available. For instance, if we want to look at vital signs, it's going to give us every step that the student needs to complete in order to earn their vital signs competency. During the skill, please note every step that the student performed. Was it either performed incorrectly or was it not performed at all? Once you return back from the patient care area with the student logged on, you can begin the competency. Make sure that all of your drop-down boxes are filled in with the correct date. If you are filling one out for a previous date, we do that again just like we did the evaluation. Choose your student. Select your site. Select your patient care area. And then, of course, the date. In the conditions box, we can just add anything. So if this was a live patient, we can put that, or if it was a demonstration in the equipment room, we can put something like that here. All of these drop-down boxes, each step incorporates a drop-down box. They default automatically to satisfactory. So if you have a student who has completed a competency who has forgotten a step, forgotten it completely, we're going to choose not observed. However, if they've done the step, they've just done it incorrectly, we're going to choose unsatisfactory. Or if we have a step that's not applicable for that situation at all, we're just going to put not applicable. So we're going to fill out a drop-down box on every step. And then at the bottom, if you have used your generic login again, please, we ask that you put your name in the additional comments box so that we know who's evaluating the students, or anything that the student needs to work on, we can add here in the additional comments. So if we have a student that has forgotten to identify their patient, we're going to add that here. Okay, very important at the bottom, there is one overall performance evaluation drop-down box. That's how the student performed on this procedure overall. That does not default to satisfactory. It requires that you choose an option. So satisfactory means that the student has passed this checkoff. Satisfactorily, you think that they are competent to practice this procedure in the hospital. That's satisfactory. Minor unsatisfactory, our student has made some errors, maybe of omission, but you feel that they still need to go back and remediate on this and perform the skill again. Major unsatisfactory, the student has performed some critical errors, needs remediation, and will have to perform the skill again. Once you've gotten all these drop-down boxes filled out, you've added your name here in the additional comments box, and you have filled out the summary performance evaluation overall, simply come down here and click Adult Vital Signs Add. That will change with whatever competency you're filling out, and click Add. And that becomes part of the student's record here on DataArc.